Hello, today I'll be going over brain trauma and neurolinguistics by, of course, myself, Christopher Mitchell-Calvi. For my topic, throughout this presentation, I'll be analyzing the effects that brain trauma has on neurolinguistics and language on different individuals. I'll be primarily focusing on patients who experience strokes, epilepsy, concussions, and lacerations. Along with this, I'll go over the different types of rehabilitation procedures patients go through in order to recover and correct their language deficiencies. For my research questions and hypothesis for my question, I ask, how do different brain-related injuries affect the neurolinguistics of different individuals, such as those who are victims of strokes, epilepsy, concussions, and lacerations? For my hypothesis, I stated, I believe that the languages of individuals are greatly affected by the outcome of these events. However, I believe that the effects of each event, stroke, epilepsy, concussion, etc., are solely dependent on the severity and location of said trauma. Now, my methods and reasoning. What did I do to get my information? Throughout this process, I relied heavily on the textbook and Google Scholar. I was able to find a good portion of my information on Google Scholar, such as case studies, definitions, and different practices using brain surgery between 1950 and now. I also interviewed my friend over the phone. My friend Alexis suffered from severe brain trauma after multiple concussions while performing for her cheer squad. I talked to her and her family about the daily struggles she has to face as a result of her head trauma and the therapy she has to go through. All of the case studies in this briefing are real, and they have helped me to better understand what they have to go, or what neurolinguistics and what the patients have to go through. Now for my findings. For strokes, a stroke can be defined as a sudden death of brain cells due to a lack of oxygen caused by a blockage of blood flow or rupture of an artery to the brain. Strokes can have severe consequences on individual language and grammar. Approximately 795,000 people annually suffer from a stroke in the United States. Many of these patients experience different language deficiencies as a result of damage to either Wernicke's or Broca's area of the brain. People who have a severe stroke can experience extreme aphasia, in which they are unable to verbally express themselves, have trouble understanding speech, and have issues with reading and writing. These different aphasias include Broca's aphasia, Wernicke's aphasia, global aphasia, and conduction aphasia. The most common aphasia that stroke patients experience is Broca's aphasia. Victims suffer from the inability to plan and use their motor sequences used in their speech. They oftentimes sound haltingly and have trouble forming complete words and sentences, and often use telegraphic speech. Patients also lack morphological inflection and function words such as and the when making sentences. They have no issues understanding the speech, but only producing it. This is a direct cause of brain damage to the left frontal area of the brain. The second most common aphasia is global aphasia. Survivors of this type of aphasia oftentimes have trouble forming any coherent words or sentences. Unlike Broca's aphasia, people who suffer from global aphasia have trouble understanding most words and can only understand very few. Oftentimes, they are unable to communicate or understand what others are saying. This type of aphasia is a direct result of severe damage to the front and back regions of the left hemisphere. As you can see, Broca's area is in the frontal lobe in the fore section of the brain, kind of creeping in the parietal lobe, and Wernicke's area is located in the mid-center, back-center area near the occipital lobe. Now, damage to this area can cause global aphasia and issues with reading and writing. Now, for a case study, there was a man named Roger. He was 71 years of age, and it's been a month since he had his last stroke. Roger is clueless to his condition and can only say 20% of his words properly. He is also unable to copy his name and understand written help. Roger is suffering from severe global aphasia. This means that both his front and back regions of his left hemisphere were severely damaged. For treatment, in order to treat Roger, he must undergo 6 weeks of intensive speech therapy. Roger was able to regain his ability to answer questions correctly 95% of the time. And at the end of this, he also had a 30% increase in naming and a 26% increase in word processing. Now for epilepsy. An epilepsy can be defined as a neurological disorder marked by sudden recurrent episodes of sensory disturbances, loss of consciousness, or convulsions associated with abnormal electrical activity in the brain. Epilepsy is one of the most common neurological diseases in the world and affects roughly 2.3 million adults in the United States alone. Severe epileptic seizures can cause brain damage in patients and can cause aphasia. One such syndrome is the Landau-Kleffner syndrome, in which individuals experience intense seizures near Wernicke's area near the left temporal parietal region of the brain. When the Wernicke's area of the brain is affected, individuals have trouble understanding speech and language and usually produce semantically incoherent speech. They also often have trouble following simple instructions such as stand up because they have difficulty understanding what the speaker is asking them to do. Unlike people who have permanent damage to the Wernicke's area, people who experience epileptic seizures near this part of the brain usually only experience this for a short time. After a while, they eventually regain their ability to understand language and retain their lexical vocabulary as long as there is no serious damage to Wernicke's area. When this occurs, however, patients are unaware that they are having issues um, um, and have no idea that when they say things that it makes no sense. As the seizure increases in intensity, so does the effect on language and comprehension. Although epilepsy is very common, it is easy to treat with medication. However, this was not always the case. Before the use of medication, people who had severe epilepsy underwent split brain operation. Doctors would cut the corpus callosum, the broad range of nerves that connect the two hemispheres of the brain, in order to cut the electrical connections that cause the seizures. After the procedures, doctors noticed that patients who underwent split brain operations had trouble with both language and motor skills. When an object was placed in the patient's left hand, they would often have trouble describing the object, because motor skills are the opposite of the hemisphere in which they are in, right hand for left hemisphere and vice versa. The patient's awareness to the object was not able to be properly conveyed to the opposite hemisphere. This demonstrated to scientists that not only did the brain rely on the corpus callosum to communicate between the two hemispheres, but it also meant that the left hemisphere of the brain was primarily language dominant. Now for concussions. Concussion can be defined as a type of traumatic brain injury or TBI caused by a bump, blow, or jolt to the head, or by a hit to the body that causes the head and brain to move rapidly back and forth. The sudden movement can cause the brain to bounce around and twist in the skull, creating chemical changes in the brain and sometimes stretching and damaging brain cells. Although a single concussion may not be fatal, multiple concussions can result in serious brain damage and even death. Most concussions in the United States are sports-related, and there are approximately between 1.6 and 1.8 million reported annually. People who suffer severe concussions also oftentimes have trouble understanding language, memory, and expressing language in reading and writing. The most common form of aphasia that trauma patients experience are Wernicke's aphasia and Broca's aphasia. However, this is often associated with problems with the angular gyrus. As a result of damage to the angular gyrus, patients usually develop alexia and agraphia. Patients are unable to read and comprehend words or write them as well. Patients are able to be treated, but only through extensive speech therapy that can last for months. If you look in this picture, you can see the concussion before, during, and after the 4 weeks, and during you can see that this area is very lit up on the scans. Now for a case study, my close family friend Alexis has suffered from a severe brain injury as a result of multiple concussions due to being dropped in cheer. In late April of 2016, she had to be hospitalized as a result of severe swelling in her brain. After extensive surgery, they were able to finally relieve the pressure in her cranium. The true battle, however, really started after recovery. She had serious head injuries in her Wernicke's area in her brain, and was also diagnosed with both alexia and agraphia. When I had talked to her on the phone, she was still going to speech therapy, and she had difficulty understanding what I was saying, and told me and had trouble making coherent speeches over sentences over the phone. When I eventually talked to her mom, she told me that she had to be withdrawn from her classes because she was not able to read or write any clear sentences. This was a result of the alexia and the agraphia. Alexis also suffered from anosognosia as a result of the damage to her temporal lobe, making her unaware that she was actually making any of these errors in her speech. Although Alexis is doing a lot better, she has a long way to go with her speech therapy. For brain lacerations, a brain laceration can be defined as something that occurs in the cranial trauma that fractures the skull, causes severe acceleration or deceleration, and penetrates the skull and brain tissue. We have already talked about the effects of severe head trauma that has caused damage to certain areas of the brain, but what happens when an entire area is removed, such as by lacerations with surgery? A study was conducted in the late 60s that looked at the ratio of head lacerations of soldiers during Vietnam. Some type of aphasia resulted in 244 out of 1030 patients, while the patient was physically recovered. Out of these patients, only 34% or 84 cases recovered from aphasia within 10 years. These cases improved regardless of the type of bullet fragment and the severity of the wound. The results show that despite the intensity of the head laceration, a small portion of these affected were unable to successfully recover. However, those that did not show improvement still had issues with regards to their language production, both physically and mentally. From my analysis, we can conclude that language relies heavily upon Broca's area and Wernicke's area. However, this does not mean that speech therapy and medicine cannot help people regain their ability for language and production and interpretation. Over time, most people are usually able to improve from in their linguistic capabilities, although this ranges from a few weeks to a few decades. The human brain is oftentimes able to compensate for damage or missing pieces. So from my conclusion, we looked over the different effects different brain traumas have on individuals and how certain areas of the brain drastically affect language production and interpretation. I also listed case studies for both strokes and concussions and provided a personal interview. And these are my sources. So yeah, if you have any questions, please comment below.